Maverick Physical Therapy, welcome to a little Transformational Zone 1B of pitching mechanics. We won't re-highlight the TZ1A stuff so that we can kind of get right after the TZ1B, but to re-highlight what TZ stands for is Transformational Zone. Transformational Zone stands for a key pivotal point that we as human beings use to load movements so that we can move. Movement's a direct response to how well we load. Transformational zones is where we as physical therapists spend our time assessing and treating in, because that is an area in which injury occurs due to a lack of loadability. So within the throwing mechanics, there's different segments of three-dimensional loading that's occurring because proprioceptively speaking, we have these sensory receptors that are in all of our tissue that are sensitive to stretch, compression, and tension that provide us good feedback, but then it also gets super jazzed up and excited by being able to load. It's okay, Mav, I'll be down in a couple minutes and we'll play. Maverick wants to jump in the pool. So TZ1A, let's go through it with kind of the stretch position rather than the wind-up to keep things simple as we go from TZ1A to B right now. And we're going to talk in this episode about the functional biomechanical sciences for you nerds out there that love that stuff. So with regard to TZ1A, we noted that was a key feature and loading point within pitching mechanics. And then as we transition out of TZ1A, we transition to what we call TZ1B to TZ1C, and then TZ2. So in TZ1B right here, biomechanically what we have taken place at the foot and the ankle, so from the ground up, based on the upper extremity loading of the arms, glove side arm and the throwing arm right here, we're able to, we talked about before, further load from the top down, the scapula on the right side, thoracic spine, the right hip, and the right foot and ankle. So as we transition from this inverted position of the calcaneus and the subtalar joint, we're going to transition on out, everting that calcaneus. We're going to start to evert that, so that this tibia right here can, with relation to the femur, abduct to give us abduction at the right knee. So as the tibia now is rotating towards home plate faster with the femurs, we also get internal rotation and extension of that right knee. The femur is rotating towards home plate, so to the left. As that femur is rotating to the left, the pelvis is as well, but not as fast, giving us internal rotation of the right hip and relative abduction because of the femur abducting from the pelvis as the right side of the pelvis drops down on the right side. So we also, with regard to the pelvis, talked about kind of these rotation and translation factors here, about how we get this posterior rotation. And as we kind of transition our way on down right here, we're starting to get kind of a little anterior rotation in TZ1B before we transition to posterior rotation again, or rather some more kind of anterior-like translation of the pelvis on the femur that gives us more extension, which from the top down we get more posterior load, kind of rotation of the right scapula with that right-sided kind of side bend and rotation. So as we transition on down right here, we're going after, and we're getting hip extension, we're getting abduction, we're getting internal rotation. The femur, the pelvis was rotating to the right, and as the left leg comes and transitions out of TZ1A to TZ1B, it's starting to again rotate to the left, but not as fast as what the femur is giving us. Again, that internal rotation. From the top down, further on up, the glove side arm is up, which is loading kind of this out of sync rotation of the thoracic spine in relation to the hips to give us this rotation and this side bend, this kind of type 2 kind of out of sync right here, kind of rotation and kind of sequencing, I should say, throughout the thoracic spine. So TZ1B, side bend with the glove side arm furthering to kind of elicit this load at the right side, at the right hip, the side bend, but then also that internal rotation from the top down by slowing down the trunk and its rotation kind of to the left and towards home plate. We're getting this relative, this right rotation. So with regards to the kind of biomechanics of looking at a model right here, we have kind of this posterior rotation taking place of the pelvis in relation to the femur. We've talked about in TZ1A how the left side becomes a bottom down driver into that right hip then. So we come from this TZ1A position and transition out. We get this abduction and we get this relative kind of internal rotation yet as things from the bottom up are starting to head towards home plate faster and quicker than what the pelvis kind of would. So TZ1B, the transformational zones of pitching mechanics, vitally important to be able to be efficient with those loadings so that we're able to scathe off the shoulder and the elbow injuries that we're so frequently seeing of today. In episode 2 of this, we're going to go through some training, some activities, some self-mobilization techniques that are some of my favorites for kind of specifically going after this transformational zone. In terms of our loadability, things to consider are that biomechanically, I'm not telling you what you need to do in terms of the nitty-gritty for your pitching mechanics. I'm not a pitching coach, but what I am is an applied functional scientist, an expert in functional biomechanics, and I'm here to tell you that period after what I'm going to say, biomechanically, there's things that drive and load motion throughout your body that need to occur, and if they are not occurring, you 100% will accumulate fatigue, pain, and wear and tear throughout your system. TZ1B of the throwing mechanics starts from the bottom up as well as the top down. We've talked a lot about the foot and the ankle. We've talked a lot about the hands and their placement and continuing to load from the top down. We've talked about how vitally important throughout our Kinetic Linking Friday episodes, how important it is for tissue and its three-dimensional characteristics to explode in some dimensions while they're still loading in others to further drive that slingshot-like effect, that bouncy ball-like effect, to provide more efficiency and more explosion, and then to provide more loadability after we produce the movement. Again, as a society and in this industry, we've become very, very focused and driven and obsessive upon the motion itself, movement, but we need to look at what causes and what creates that, what controls that, what controls that to what that tissue does to cause motion. Are our big concerns. In the middle of this top-down and bottom-up driver, we have this pelvis that's hanging out, that's driving, that's loading. And so in TZ1B, we've talked about the rotation, the translation components of this pelvis. So the body acts as this teeter-totter-like effect through these transformational zones, whatever task or function it is, to give us better explode. So we go from a pelvis, which is kind of posteriorly rotating, to now we get some anterior rotation. We get some anterior rotation with some translation laterally to the left for that right-handed pitcher. We get this inferior translation as our center of gravity drops, and we get almost this relative. We do get that relative internal rotation, this effect of, hey, the pelvis is rotating to the left, but because the femur's rotating to the left faster, we get this effect in which, hey, it almost appears as if it's rotating to the right, almost like if you were to pass a car on the highway, you're going 80, they're going 70. You would look in your rear view mirror and say, hey, they're going in reverse. They're not. They're going in the same direction you are, just at a different speed. We've also talked about kind of how this rotation then in the frontal plane of the pelvis, right side kind of dropping down to help give us this this abduction of the right hip right here will kind of, I believe, will kind of compact itself with and transition from almost kind of this posterior shift to kind of this anterior translation here to take a better kind of effect and kind of absorption of the gluteal kind of loading in both hips right here, to be able to then transition us to TZ1C, in which we're starting to get that anterior translation. So we're constantly getting that slingshot-like effect, that teeter-tot-like effect going back and forth. TZ1B of the pitching mechanics, we're in episode 2 of this. We're going to highlight some things with some specific activities designed to really open up the mobility of the hips and the mobility of the thoracic spine with what we call some of our in-sync and out-of-sync kind of motions and kind of sequencing. So play around with these exercises, guys. I think you're really going to dig what we have in episode 2.